Hello, this is Colonel Judith Lee. I'm the commander at Landstuhl Regional Medical Center. I'm here with my nursing colleagues because I am also a nurse. We recently had a Joint Commission survey that found that our nursing care plans were not individualized. So I'm here to just express to you that I am very supportive and very concerned that we ensure that our nursing care plans are up to date. Not only is it mostly important for the patient, it's important for your colleagues who need to follow in your footsteps for the care of that patient. It's also important for nursing practice. This is what defines us as nurses. You are the ones that are at the bedside taking care of the patient hour to hour, day in and day out. It's incredibly important that you document what is going on with that patient and importantly to individualize that nursing care plan. Serving to heal and honored to serve.
Hello. This video was created as a high-level overview and refresher on how to do a nursing plan of care. As you've just heard from Colonel Lee, this is an important aspect of patient care that is required by the Joint Commission and a focus of the command. When you have completed viewing this video, you should be able to recognize patient care needs, identify nursing problems that meet those needs, discuss interventions implicit in the plan of care, establish and monitor measurable outcomes, and understand requirements for documentation of a plan of care. As nurses, we know better than anyone that our patients have a range of needs, but sometimes it's easy to skip from assessment to intervention without documenting the need that is identified. Most of them are in pain, most of them are anxious, and all of them need to know what is going on. Plus, we also know that you're going to keep them safe and respect their autonomy. We know that you're doing this, but we need you to document that process. The first step is recognizing your patient's needs. When you first assess your patient, what goes through your head? Is he in pain? Does he appear anxious? Is he hot, cold, clammy, dry? How is his breathing? What's the air exchange? This is all part of the planning of care that you do when you take care of your patient. Let's go through a care scenario to reinforce things. John is a 28-year-old soldier admitted to aide. He arrived by air evac mission 2 hours earlier. John was wounded by an IED blast while on foot patrol. Initially, John had a GCS of 15, which deteriorated to a GCS of 9 on admission to the Level 2 facility. He is currently in a GCS 13 with some intermittent confusion. He sustained significant trauma to the left lower extremity and has several areas of shrapnel damage and abrasions, including a full-thickness loss of skin to his left cheekbone. His wife was notified of his injuries and transport to LRMC, but has chosen not to travel to meet him nor to receive any further updates on his care. He has no other family. What would be some of the nursing identified needs that John could have? You can anticipate that John is going to have some pain issues. Besides the fact that he was injured, and his buddies may have been injured or killed as well, sounds like there are some family issues that may make him a risk for depression. Everybody comes in needing to be oriented to their unit, how to express pain, etc. We already mentioned that it looks like he doesn't have any family support emotionally. Again, safety is important, and we need to assess whether any confusion exists. Now that you have identified your patient's needs, what are you going to do to help your patient resolve those needs and issues? You see John is in pain and you assess how much pain. That assessment is one of your interventions. In this particular case, your other interventions may include administering pain medications as ordered, documenting John's responses to those medications, repositioning for comfort, and providing John with distractions to help him think about something other than his pain. Interventions are used to assist your patient in reaching a goal, and therefore need to have objectively measurable outcomes. In the case of John and his pain, your goal would be that his pain is decreased to the point that it is tolerable, perhaps a 2 or 3 on a 10 scale. When you assign an objective value, such as 2 of 10 pain assessment, you're setting a measurable outcome that the next nurse can also work towards. Other examples of measurable outcomes for other patients might include ambulate 50 feet using a walker, repeat back instructions for taking a medication, drink 2 cans of Ensure. These goals need to be individualized to the needs of your patient. Let's say that we got John a PCA pump, and you've instructed him in its use. your instructions to him being one of your interventions. What measurable outcomes do you want to see? In this case, you want him to tell you how the PCA works and show you that he can use it appropriately. So a good measurable outcome would probably sound like patient will be able to verbalize and demonstrate use of the PCA. Once you have identified your patient's needs, interventions, and outcomes, you can begin documenting them in a centris. To help you do this, a centris has pre-templated nursing problems, but you need to individualize them to your patient. So I'm going to show you how we would document a comfort plan of care for John. Please keep in mind that this is just an example and not a thorough care plan. Once you have your patient up, go to the Notes page and right-click on one of the rows under Topic. Choose Assign Problem from the drop-down list. Since this is a comfort issue we're documenting, when the list of problems appears, choose Nurse Comfort, and then click OK. The date and time entry box will appear, so click OK to accept it as well. When the note appears, under the first heading of Nursing Diagnosis, we're going to type in lower extremity trauma. You could also address his cheek as far as comfort, but we're just going to stick with the trauma here. Moving on to expected outcomes, John is alert and able to communicate, so we're going to discuss what is a realistic pain threshold for him. And we are going to say 4 out of 10 and document that into the line. Next, what interventions are we going to do to help John reach that outcome? As you can see, some of these are preset interventions that apply to all individuals that are in pain. Assess their comfort level, provide comfort measures, administer ordered medications, educate the patient or family member about meds and what to expect during the healing process, and monitor and document the effectiveness of the pain meds. So, what else can we do for John that is specific to him? By the way, don't hit the Enter key in this section until you are done entering additional interventions. If you do, you will save it and move on to the next field. Therefore, simply hit the space key between each of your added entries. We know that John has a lower extremity wound, so positioning will be important. Let's type that in as the 6th intervention. And since he has some open wounds, he is probably going to be in pain when his dressings get changed. So let's put in a 7th intervention to pre-medicate prior to dressing change. I'm sure you can think of some other interventions that would apply, but let's go ahead, save these, and move on to a status update. Every 12 hours, you're going to update John's status. So the first thing we're going to document in that field is that the plan of care was initiated. His current pain rating is 3 of 10, and he is receiving his pain med with good response. And now we need to time and date that by clicking in the next field, and then clicking on the timestamp button up on the icon bar at the top of the screen. Verify that the time and date field was populated, and then save the note by clicking on the Save icon in the upper left of the screen. You may have noticed that the underlining disappears from the note. This is the visual indicator that the note has been saved. Now, let's say that John has been with us 4 days and is ready to be discharged, so you need to indicate what his discharge status is as far as comfort. To do this, click on the Pre-Discharge Evaluation. We're going to say that John is currently 2 of 10 on a pain scale and taking Percocet orally with good effect. Now that we've entered his pre-discharge status, let's save this. Sign the note, and then hit OK. You're done with this note, so simply exit out of it. Now that you are back on the main notes page and John's comfort care plan has been completed, it's time to resolve it. To do this, simply right-click on the note, choose Resolve Problem from the drop-down menu, sign and timestamp it, and the note is resolved and removed. But suppose you have identified a need that is not on the list of pre-templated nursing problems. No problem. A centris allows you to create your own. Now I will show you how to create your own personalized nursing diagnosis, interventions, and outcomes. Start the note as you normally would by assigning a problem from the problem list. But choose the generic Nurse Prob template. Click OK and timestamp it. blank template will then appear so that you can create your own note. For our nursing diagnosis, we know that John had a closed head injury, so we're going to put potential alteration in mental status related to closed head injury. For our expected outcomes, we will put patient will not experience any unexpected changes in mental status. For John's nursing interventions, we are going to do those things that will help him remain oriented and help us detect any changes in his mental status. First one will be neurological assessments as ordered and as needed. Another thing that will help John clear his mental status will be to maintain a day-night sleep schedule and to orient and reorient him to his surroundings as needed. And of course to provide comfort rounds and keep him safe as ordered. For the status update, we're going to say plan of care initiated and patient is currently GCS 13. Please note that in the future, this problem template will look like your other pre-assigned templates and have a field for timestamping the note as well as a pre-discharge notes field. But for now, let's save this note, sign it, and close it. Great! Now the next shift can come along in 12 hours and update it again. This will continue until it's time to discharge him, at which time you would do a discharge evaluation, just like the one we showed you in the last example. We've talked about how to identify needs, interventions, and goals, but we also want you to realize that your plan of care is part of the overall patient plan of care. Nurses are the professionals that are at the bedside 24/7, and the interventions and goals that you set for your patient have a profound impact on that patient. By this point, you're probably asking yourself, why the big push for nursing care plans all of a sudden? One of the findings by the Joint Commission was that we were not ensuring that our care plans were individualized to the patient and that they didn't cover all of the patient's needs. As a result of this finding, we have 30 days to present a Get Well plan. This video is part of that plan. In other words, it's one of our interventions. Our plan also has measurable outcomes. In this case, the LRMC will design thorough and individualized patient care plans. We will do this by using a chart audit tool that was designed by the Plan of Care Committee, which looks something like this. This audit tool will be used to assess our compliance for individualizing patient care plans. The criteria for the chart audit includes timing. Was the care plan initiated within 12 hours of admission or unit transfer? Were at least 3 diagnoses created, 1 for knowledge, 1 for safety, and 1 assessment specific? For instance, why is your patient here in the hospital? The more complicated your patient is, the more diagnoses you need to address. Each unit may increase the minimum number of diagnoses they require. For example, ICU patients are complicated. The minimum number of nursing diagnoses for ICU patients is 5. Moving down the list, for those diagnoses, were goals identified and met? Did the nurse document the daily status in moving towards those goals? If the patient is being discharged, did the nurse document the patient's final assessment and status? Did the nurse close out the nursing care plan or discharge? This audit tool is designed to document our progress towards resolving our Joint Commission finding. We know that you provide excellent care. We just need you to document that care. Because this training is mandatory and you really don't want to have to sit through it again, make sure you get credit for watching this video. To do that, first check that you are logged on to this computer using your own CAT card, and then click in this blue box. This will create an email that you can then send to the nursing department, and it will verify that you've watched this video. This concludes the overview of how to document a nursing care plan. If you have any questions about this or any other nursing-related subjects, please contact your CNOIC or clinical nurse specialist for more information.